Let's know more about cataract from the experts.
Hi, I'm Dr. Abhinav Dhami. I'm a consultant at Dhami Eye Care Hospital. I deal with cataract, retina, and ROP services in Ludhiana at Dhami Eye Care Hospital. So, the topic for today is that what is cataract and what are the outcomes that we are supposed to expect from those things? So, cataract is basically the whitening of the natural lens of the eye, which is given to us by God. And over a period of time, sometimes with age, sometimes with diabetes, sometimes other disorders, the lens material it becomes opacified. That means it becomes the fibers become thickened and they become white. And so it leads to decrease in vision. It leads to foggy vision. Sometimes people complain of glare. Sometimes they may even have double vision. So when patient comes to us, when patient says, I have decreased vision or I have foggy vision, that's a sign, that's an indication that person may have cataract. So how can one check cataract at home? You can just look at a normal clock or you can look at the surrounding around you. If you think that you're having difficulty in seeing the normal objects that were clear to you before, then you need to think of cataract as one of the possibilities for decreased vision. Now, once the patient comes to a hospital, he has to go through a normal checkup. He has to get his vision checked. On the basis of that, we assess what grade of cataract are we dealing with. And depending on that, the procedure is decided. Now, for the last 2 or 3 decades, cataract surgery has gone through a innovation and in a different manner, in a different types. And at point, we are dealing with phacoemulsification, the intraocular lens implantation. Phacoemulsification basically means that we are trying to emulsify the nucleus. We're trying to remove the uh, cataract that has become opacified and trying to replace it with an artificial lens. Now, there are different types of artificial lens that can be implanted inside the eye. So the just to give you an idea of what these are. So the first one is monofocal lenses. Monofocal means that they work for distance vision clearly, and for near vision, one has to use glasses. Then there are multifocal or trifocal lenses. That these lenses have rings in them which allow the person to see for distance, intermediate, and near vision. The only disadvantage is that sometimes it can lead to some glare and difficulty in night driving. Now, with recent advancements, we have EDOF lenses, that means enhanced depth focusing lenses, which allow you to have a very good distance and intermediate vision. And off not, even though there are multiple new lenses coming in, but nowadays the major focus is going on EDOF and trifocal lenses. Now, what to expect after cataract surgery? Suddenly, the person might feel that, oh, my vision has just come back. But it's not the case. Sometimes the cataract surgery may take a week or so for you to recover. Now, when you come to us or when you come to any hospital for an eye checkup, they will do an anterior segment evaluation to see what kind of a cataract you have, and they'll do a retina checkup just to make sure that you don't have any retinal problems, especially in patients with diabetes, hypertension, or any age-related macular degeneration, which can impair the vision postoperatively. Once you've gone through that, you will have your IOL power calculation. That means they'll use machines to take out the power of the lens that has to be implanted inside the eye. Sometimes the lens may be specifically made for you, which are called toric lenses. After that, now you've come and now the day has come that you have planned for cataract surgery. Now, nothing to fear. Cataract is done under topical anesthesia. That means we use just drops to anesthetize the eye so that you don't feel any pain during surgery. Once you go into the operation theater, the cataract surgery time may take around 5 to 10 minutes, depending on how long or what grade of cataract you have. Sometimes it may even take longer, depending on what is the mode of cataract and what type of cataract we're dealing with. But once your cataract surgery is done and the lens is implanted, you may have to have an eye patch for a couple of hours. We may ask you to remove the patch after 2 to 4 hours and start the topical eye drops. The topical eye drops usually include antibiotics, steroids, lubricants, and mydriatic agents to decrease the pain postoperatively. And within a week to 10 days, the person is back to normal life. Now, does the biggest question is, does cataract surgery ensure a removal of glasses? So that has to be discussed with the doctor. That has to be discussed with various lenses that one is using. Not it is a type of refractive surgery, but it still needs to be considered that there is a chance about 5 to 10% that you may need glasses. So anyone who's planning for cataract surgery, don't be afraid. It's a very small, but yes, it's a surgery that can take time, a surgery that requires a lot of precision. And this, every surgeon has gone through years of training to treat you and give you the best of vision. Thank you.
Act early, prevent early. Driving change to defeat cataract.